Hey everyone, and welcome to MediByte. I'm your host, and today we're going to tackle a really important topic, the well woman visit. You know, it's one of those things we're told is a cornerstone of preventive health. But let's be real for a second. For a lot of us, it can bring up a ton of questions, maybe even a little bit of anxiety. Well, our goal today is to clear all that up. So, what is a well woman visit really? Why does it matter so much? And maybe most importantly, what actually happens when you walk into that room? We're going to break it all down step by step so you can walk into your next appointment feeling totally confident and prepared. All right, so first things first, let's talk about why this is all about preventative care. See, this isn't an appointment you make only when you're feeling sick. Nope, this is one of the single most proactive things you can do for your health down the road. Basically, a well woman visit is a regular checkup that's completely tailored to you, your age, your health history, your unique risk factors. Think of it as your dedicated time to focus on staying healthy, and it covers the whole gamut: screenings, a general evaluation, counseling, and even getting up to date on immunizations. And I really want to stress this. It's so much more than just one test. This visit is this incredible opportunity to screen for a whole bunch of different health issues. We're talking about checking for things like high blood pressure, cholesterol, and diabetes, but also screening for cervical and breast cancer. And it's a safe, confidential space to talk about anything from issues with your period to pelvic health and even things like depression. The whole point is to catch things early, because early detection can make all the difference, turning something scary into something totally manageable. That's the real power here. Okay, so you're probably wondering, what actually happens during one of these visits? Let's dive in and walk through it, because honestly, just knowing what to expect can make a huge difference. You can really think of the visit in four main parts. First, there's the conversation. That's where you get to share your health story. Then comes the physical exam, which is like a snapshot of your health right now. After that, you'll cover any screenings or immunizations you might need. And finally, you'll wrap up by talking about your personal health plan and what the next steps are. So everything kicks off with a simple conversation. Your doctor or nurse practitioner will ask about your health history, especially your obstetric and gynecologic history. You know, questions about your periods, any pregnancies you've had, your sexual health, that kind of stuff. This chat is super important because it really lays the foundation for all the care that follows. Okay, let's clear something up that gets confusing for a lot of people. The difference between a pelvic exam and a screening test, like a pap test. A pelvic exam is a physical check where the clinician is feeling your reproductive organs, like your uterus and ovaries, to check for things like fibroids or cysts. A pap test, on the other hand, is a screening where they collect cells from your cervix to look for any changes that could potentially lead to cancer. And here's the key. You might not need both of these at every single visit. It really depends on your age, your history, and current guidelines. And remember, this is a well woman visit, not just a gynecological exam. So your clinician is also going to do a general health check. They'll definitely check your blood pressure, and they might do a breast exam to feel for any lumps or changes. It's really about looking at the big picture of your overall health. All right, now we get to what is, in my opinion, the most important part of this whole thing: your voice in the room. This isn't something that just happens to you. It's a conversation, a partnership, and what you have to say is absolutely essential. And this quote really says it all. You absolutely have to find a healthcare professional you feel comfortable with. I mean, you're going to be talking about some really sensitive and personal stuff. The whole visit is built on trust, so feeling safe and heard is just non-negotiable. Your comfort truly matters. This is your time to talk. Seriously, it's your turn to ask all the questions. Are you wondering about your menstrual cycle? Dealing with some weird bleeding or pelvic pain? Curious about birth control options? Maybe you're even thinking about getting pregnant, or you're navigating symptoms of menopause. All of it is fair game. Remember, you are the #1 expert on your own body. If something doesn't feel right, you have to speak up. There is no such thing as a dumb question when it comes to your health. Okay, so as we start to wrap this up, what's the big takeaway here? It's simple, really. Think of this visit as a proactive health partnership. Your well woman visit isn't just another appointment on your calendar. It's truly a partnership for your lifelong health. It's you and your healthcare provider on the same team, working together to keep you healthy and strong through every single stage of your life. So I'll leave you with a little homework, a question to think about. What's one thing you're going to ask at your next health visit? Just thinking about it ahead of time is a super powerful way to start taking an active role in your own health journey. And that's a wrap. Thank you so much for watching this MediByte explainer. We really hope this helped clear things up. For more straightforward health information just like this, please make sure you like, share, and subscribe to the MediByte channel. We'll catch you in the next one.